Hi, everybody. My name is Dr. Ruben St. Laurent, and I'm a functional neurologist here at ProNeuro Health. And I've got to talk to you about a topic that's been near and dear to my heart, and it's been bothering me. It's about this COVID-19 and the effect of vitamin D. And the reason why this is really important to me is because this is where I grew up in Brooklyn, New York, and I'm watching as the people in New York City are being ravaged by this disease. And I tried to figure out, why is New York City the epicenter of this disease? And I started looking at the data. Over 8 million people live in New York. Now, in New York has the largest African American community in the whole entire country. And so I thought to myself, hold up, I really felt like it was a conspiracy theory, because I said to myself, why is the place with the largest amount of black people being killed off? And so I started noticing the morbidity rate for black and brown people. 51% of the deaths were black and brown, 32% were white, and 14% were Asian. And I started thinking to myself, hold up, is this truly a black problem? But then I found out, then I talked to my white colleagues, and I found out that they didn't know either. So it's not a black or white problem, it's an information problem. And the information I'm talking about is the fact that we know that vitamin D is vital for immune function. And this is what was the missing piece, and why people are being infected like crazy in New York. And here's the data from the NIH, the National Institute of Health, where Dr. Fauci is the head. And this peer-reviewed information, which is the highest level of scientific data, this is what it says. It says that vitamin D can modulate the innate and adaptive immune response. So deficiency in vitamin D is associated with the increased susceptibility to infection. And the reason why this is important is because in humans, vitamin D is obtained two ways. One is through diet, and the other is through exposure to light from the sun. Now, the reason why this is important is because the way that vitamin D is blocked is one by sunblock and another one by high skin pigmentation. So you have high melanin. If you're brown or black, you have a decreased ability to actually get the UV radiation from the sun, which then synthesizes vitamin D when it goes through. So now the next thing that we have is that because of the latitude, because of the position of New York, it's a higher latitude away from the equator. That means that over 60% of the sun's rays miss the surface. So only 40% of the sun's UV light actually gets to hit New York. Now, on top of that, you're in cold climate and you're wearing clothes. And so all the receptors are located on your arms and your chest and your legs. And you know what? You can't absorb vitamin D that way. So this means that you have an increased chance of deficiency in vitamin D and an increased chance of being infected. So this information, we've been sitting on this for a long time. I'm trying to figure out why someone hasn't said anything. And it says right here that you have increased susceptibility to infection. And so I know a lot of people were talking about the vaccine. And yes, looking for a vaccine, I understand why. But we can do a preemptive strike by simply infusing people with vitamin D. So the question is, why have we failed our people? And why isn't everyone talking about this? Because everyone should be taking vitamin D. Even in my clinic, we have vitamin D and K2. And the reason why you have K2 is because that's a rate limiting step to actually having vitamin D function. So if you take those together, you automatically have increased levels of vitamin D and increased immunity. So the question is, why was this not talked about? Why are we allowing our people to stay ignorant? And the reason why I'm upset is because this is information that every American should have. These are the conversations that our politicians, our doctors need to be having with the patients. So I implore you, if you know anyone, share with them vitamin D is needed. And if you can, make sure that it has K2 with it, because that's what's needed to actually allow the vitamin D to work and increase your immune function. Again, my Dr. Ruben St. Laurent, and I appreciate your time. Thank you.